my name is Lauren, and my case study is on an internal oblique tear in an MLB pitcher. So what is an internal oblique strain? Well, it's commonly known as a side strain, and it's caused by throwing, swinging, or any twisting motion. So therefore, the common sports that it occurs in are baseball, tennis, cricket, golf, and javelin. But with baseball, really any positions are susceptible to the injury because any positions are doing the throwing, twisting, batting motions that it's caused by. It's also known as a contralateral injury, which means that it happens on the opposite side of your dominant hand. So if you're pitching, it's on the side that's facing the batter. If you're batting, it's on the side that faces the pitcher. So the most common mechanism is actually batting with 45.7%, followed by pitching at 34.9%. And that was done in a study with both minor league and Major League Baseball. The recovery time can take between 2 to 10 weeks. Normally it's about 6 weeks, but it just depends on severity, whether it's less or more time from there. So with a study done between 1991 and 2010, there was a shown increase in internal oblique strains, which was proven by the disabled list that the study was looking at. And there was a total of 8,136 injuries. A total of 393 were internal oblique strains, which is pretty significant coming from a whole season. So 44% of those were pitchers, and then 42 out of 393 were re-injured within I think it was 2 years, were re-injured after they had recovered. Then there's a study done in 2017 where it showed a decrease in the injuries. So between 2011 and 2015, there were 199.2 oblique strains. I don't really know what 0.2 is, but 74 out of those still had a reoccurrence within 2 years of recovery. So there's obviously a really big re-injury rate when it comes to this injury. And the main goal for elite athletes is to minimize recovery time, but to decrease the likelihood of re-injuring. So it's really important for coaches to be aware of this injury and know how to prevent and then also how to maintain these injuries when they occur. So due to that study during 1991, there seemed to be a lot less injuries, and so they thought that maybe coaches became more aware of the injuries due to the previous study, therefore causing less injuries later on. So the purpose of my presentation is to present the case of an MLB pitcher who sustained a second-degree strain with partial tears in his right internal oblique. So the injury happened on a Wednesday game in May of 2016, so this was during their beginning third of their season. He was a left-handed pitcher and batter, so he was pitching during the third inning, and it was actually the last batter of that inning, and the second pitch for that batter. So he threw a pitch, and he felt a very sharp pain within his right abdomen, but he decided to keep pitching, and he threw again to try to get him out, and every single pitch he felt an increase in pain. Finally, once he got that batter out, he was actually the next batter up to bat the next inning. So once he got up to the plate, as soon as he swung, he felt it again. And then when he finally made contact with the ball, he hit a double, but he was only able to make it to the first base due to his pain because he wasn't able to run all the way to second base. So his symptoms were a lot of pain in his right abdomen. It hurt a lot to breathe. He could barely run. Anytime we had to do throwing or pitching motions, that also increased his pain. So looking at pitching and batting mechanics, during the pitching phase, it's most common to strain your internal oblique during late cocking and early acceleration phase. So as you can see right over here, it's during this phase when the pitcher's front foot is landing, and it's when it's accelerating most through the pitch to create the most force. Then during batting, it's during the stance to stride phase, so right here, so when they're loading up to create the most force within their abdomen to then swing throughout the whole pitch, right through these three pictures right there. And due to a study, it showed that the obliques are actually less than 30% activated when the batter's just standing there, but then they increase to 100% through the batting motion, which helps generate a lot of force when it comes to batting. So testing that was performed, the first test was Carnett sign, which helps the athletic trainers distinguish between an intra-abdominal injury and an abdominal wall injury. So the athlete was asked to raise his legs about 6 inches off the ground and hold it. He could not do this due to pain within his abdomen, so this was distinguished. It was determined that he had an abdominal wall injury rather than an injury within his intra-abdominal area. Then we did MMT, and we tested trunk flexion and then trunk flexion and rotation. For trunk flexion, he was able to perform a grade 3 by getting his scapulas off the table. And then to his left side, he was also able to perform a grade 3 due to that testing his left obliques. But then once he was testing his right obliques, he was not able to lift his scapula off the table, which he had motion, but was not able to clear the scapula, so he was given a grade 2. So after the injury, we referred him to the team orthopedic due to the signs and symptoms. And an MRI was done 2 days post-injury, so on a Friday. And then after that, he was pulled from both Saturday and Sunday games. He didn't play at all. And then on Sunday, he came into the open clinic for ice and then also pre-mod electrical stimulation over his obliques to try to help control his pain. Looking at anatomy, so there are 4 major components to the core. When people just think of core, they usually think, oh, your abs. Well, there's actually a lot more that goes to it. So there's your thoracolumbar fascia, your pelvis, your hip musculature, and your abdominal wall that all includes the core. So your TLF is an extremely strong connective tissue. It's an irregular weave of collagenous fibers that is best suited to withstand stress in multiple directions. So it's obviously a very strong connective tissue that is being pulled on by several different muscles, so it has to stay strong when that is happening. So when the muscles contract, the force is transmitted through the TLF. That causes stiffening within the lumbar spine and then causes force closure within the SI joint that then causes stabilization within the pelvis. So very important for stabilizing that area. Then the pelvis, bones, the sacrum, ilium, ischium, and the pubis bone. Then there's an acetabulum. Within there's a labrum where the head of the femur sits, and that creates the ball and socket joint of the hip. Then the muscular aspect of it, it highly depends on how these landmarks sit, so everybody's different. But the 6 different motions that the muscles create for the hip are the flexion, extension, abduction, adduction, internal and external rotation. And then the degree of movement is highly dependable on someone's flexibility. And if there's any kind of decrease in movement or mobility, then it will highly affect the athletic performance of that individual, which takes a very huge role on baseball pitchers specifically, because if they do not have strong hip abductors, it strongly affects their follow through when they pitch, because their trail leg, when they're pitching, their trail leg's coming around, and if their hip adductors are weak, then they will, it can lead to throwing across their body, which is known as very poor mechanics. So as you can see, it's all connected, and it's all very important to the pitcher's mechanics. So the abdominal wall then, there's 4 major muscles, rectus abdominis, transverse abdominis, and then the 2 different obliques. As you can see over here, the internal oblique lays right underneath the external oblique and originates on the iliac crest and the thoracolumbar fascia, and then it inserts onto the 9 and 12 ribs, and it causes flexion and rotation of the trunk. and so does the external oblique. So very important and key muscles when it comes to pitching and batting for baseball players. So looking at my athlete now, the diagnosis, the MRI was read on Monday, so right after the weekend, and they found a grade 2 strain of the internal oblique. As you can see, the white area showed that there was less muscle there, so they ruled it a grade 2 strain. He was told to rest and immobilize as much as possible, immobilize by wearing a back brace, mainly when he sleeps because he had less control then. And then we decided to go the non-surgical route because this type of strain is pretty easily recoverable just with rehab. So if the athlete's pain did not increase over the time of rehab, then the surgeon would allow us to continue with rehab. If it didn't, then he would reevaluate surgery as an option. So then week 1 treatment included, the very first day was actually a corticosteroid shot due to a study done between 2006 and 2008, where it showed that pitchers actually, their pain improved within one single day of getting the shot. And so it was able to speed up their recovery time. So he got that on Monday after finding out his MRI. And then after that, he just proceeded to do ultrasound and then ice to help manage his pain and get him to the spot of being able to start rehab. So during week 2 of this rehab, the patient is restricted pretty much from everything: throwing motions, batting motions, and crunching motions. So the purpose is to mainly regain range of motion within his trunk and also start crunching progressions. He was tested on day 5 of week 2, and he was actually able to perform grade 4 in trunk flexion just by resting and getting a little bit healthier within the area. And then, so moving on to week 3, the athlete was still not able to add any weight to his exercise and only his body weight. But during week 3, we were able to start a crunching progression due to his previous manual muscle testing. So this week we added a lot more core and a lot more core progressions. And then we also implemented some shoulder maintenance because this was one of the athlete's worries, is that he was going to lose shoulder strength and as well as his cardio fitness. So we kind of implemented some biking and we implemented some simple internal external rotation, anything that wouldn't mainly affect his core. So at the end of this week, he actually was able to get to a grade 3 of flexion and lateral rotation to his right side. So it was a huge improvement and it really helped him progress. So then moving on to week 4, the only restrictions was full throwing and batting motions. We did start implementing like kneeling throwing and one arm batting to kind of get the body used to those motions, but he just wasn't able to do those full motions completely. By the end of the week, he was still only at a grade 3 manual muscle testing, but he felt pretty confident that he was able to move on. So to be able to proceed, he had to again report no pain when he came back, and So then during week 5, the athlete really didn't really have any restrictions, but we advised him to make sure to stop if he felt any pain. Really the only bumps or upsets we had throughout rehab were him kind of feeling either sore from shoulder stuff because he was doing the same amount of weight. He just wasn't used to it at the very beginning, so he would come back the next week, oh, I'm a little sore on my shoulder, things like that. Other than that, his core progressed like we would have wanted to. So this week we kind of implemented full pitching motions and full batting motions as well. By the end of the week, he was actually able to perform trunk flexion and rotation with his hands on his head to both sides at a grade 4. But he was at a grade 4, so that's awesome. So then that means he was ready to move on to return to play protocol. This basically meant no restrictions, and we allowed him to go back to practice as we watched him throughout the whole practice. So the first first day he was back, he was just allowed to play catch with a teammate. We watched his mechanics, we watched how he did those things, and then we also made sure he reported his cane afterwards. Everything was good, so then the next day, full pitching was implemented. He moved very slow pitching, did very slow pitching, and then he built up to fast pitching. He wasn't back to his completely normal 90s pitching, but he was getting there. And so then by day 3, since no pain was reported, he did full pitching and full batting. And that was a really great improvement. So mechanics were watched, and we also talked to coaches to make sure that they didn't badger him about playing, badger him about getting back to play as soon as possible. And we also talked to him about possible like implementing core maintenance for really everybody on the team, because that's important for anyone. So in conclusion, the return to play from when he first got injured was about 42 days of treatment. Rehab focused on mainly core strengthening and then sport-specific balancing. So oblique strains are responsible for 4,400 days out of playing MLB every year, which is pretty significant. And then 8.15% of those people will experience at least one re-injury within 2 years of being recovered. So it's a pretty significant injury, and people just need to be more aware of how to maintain core strength and then how to recover when the injuries happen. So I just want to leave you guys with this quote. Core abdominal musculature plays a critical role in nearly every baseball-related movement, as it is heavily utilized for maintenance of posture, throwing, swinging, twisting, pivoting, running, and jumping techniques. So due to the rise of the injury, there needs to be more research done on proper rehabilitation, treatment, and overall care. Done. Questions? Meg?
So why is the reoccurrence of oblique strains so prominent?
I mean, I personally think, done by research, because of my research, that people, because it was the first research study that was saying that it was an increase. I think people were just unaware of how susceptible baseball players were to it, which is weird, but I don't think coaches had the